Hi there, this is Dr. Ajaya Kashyap and we will be talking about the cosmetic issues that have followed the pandemic, the recent COVID pandemic. It has happened to people who had the disease and also to people who've been stressed out because of the lockdown and because of other people around us who have been suffering from the disease. The first thing, a lot of treatments are available for lots of problems that people have. As far as the face goes, there are three main problems: the hair, the under eyes, and overall contours and skin of the face. The first thing to be done is to have a good diet. Good diet means green leafy vegetables, good amount of proteins, and overall a diet which would be antioxidant. Green leafy vegetables do well. Sometimes you can have green tea, which is also a good antioxidant. Some people would benefit from vitamin E, and others can take the supplement which are available over the counter. One good supplement is acetylcysteine, which is available in by different names. The other thing is to do a reasonable amount of exercise. We cannot go too much at this time, but do enough to keep the muscle mass as well as keeping the overall aerobic health and anaerobic health of the body. Pranayama is also a good thing. It improves the circulation of the face and of the entire body, as well as gives the lungs a chance to re-expand after all that has happened. So a good amount of pranayama will help. Yoga is always good. Yoga exercises are very good for the body and for the health of the skin. Also avoiding the sun as much as possible. Now when you avoid the sun, you should take some vitamin D, because the sun is what forms vitamin D, but it also causes problems with pigmentation and also with stressing of the skin. So avoid the sun, but take vitamin D as required, as has been recommended by your physicians. We also recommend people taking either curcumin or haldi, and that would also be an anti-inflammatory herbal medication. It is available in your kitchen, or you can get it from the pharmacy or any natural health drugstore. The other medicine I often give is Arnica montana, which is a homeopathic medicine. It is also available in other countries and they have different names for it, but the name that is commonly used is Arnica montana, and the strength that I usually use is 200, but do check with your physician to see what strength would be the best for you. I usually prescribe it beneath the tongue for about 4 times a day. One of the common issues that I see has to do with the under eye dark circles. Now the under eye dark circles can be a cause of stress, or can be because of weight loss, or having actually suffered from the disease, and that shows up as stress on the face. And one of the common manifestations of the stress on the face is the eyes. The under eye dark circles can be improved by a number of treatments, but besides treatment, the most important thing is to keep a healthy diet and not expose yourself to too much sun, and try to avoid stress as much as possible. The first treatment that we do for people who have under eye dark circles are fillers. The fillers can be hyaluronic acid fillers, which are very thin hyaluronic acid fillers, which can fill the hollows that sometimes people have under the eyes. The other treatment that I do is a series of carboxy therapies, where you inject a small amount of carbon dioxide on the side of the eye, and that inflates the bottom of the eyes and sometimes the upper eyelid also, causing carbon dioxide to give the body an impression of there being metabolic products, and the body tries to wash away these metabolic products, and in turn the darkness, the pigmentation and the appearance improves. That is done once in 10 days or so. Now this has to be repeated till the time one does not feel that the improvement is complete. The next treatment that we often do for under eyes is nano fat grafting, which is a very thin amount of fat that is taken with a needle from another part of the body, and then it's nano sized, which means very small particles are made, and those are injected, sometimes coupled with some antioxidants and with PRP, which is from your own blood, and that is injected in the hollows of the eyes. That fills up the hollows, and this result is often very long term, many years, while the fillers, which I stated before, last from 1 to 2 years. The other thing that we are seeing fairly frequently is having lost weight on the contours of the face, dullness of the skin. Those can both be treated at the same time. One of the treatments that we do is what we call a CAS lift, where PRP, some stem cells from the fat, and some autologous fat adipocytes or fat cells are also used as such to fill up the crevices of the face, as well as give highlight the contours which are going to look better, like the upper cheeks or the chin or the lips. These are again mixed with antioxidants and with platelet-rich plasma, which can be used in different quantities in different areas of the face to give volume or to give just rejuvenation or shine and contour, and also sometimes contour to the face. The third thing that we see really frequently, and that may be the most frequent thing, is hair loss. A lot of people are losing a lot of hair because of the COVID pandemic. Any stress can do that, and fortunately for a lot of people this is a reversible situation. What we usually do for this is, I request you to take some biotin, which is a vitamin, part of a vitamin B complex. The other thing we request you to do is keep a healthy diet and apply minoxidil to the head. It can be applied as a lotion or a spray. It's available for women concentration of 2%, and for men at a concentration of 4 to 8%. That can be applied twice a day. Besides that, there is a diode helmet that's available, which can be applied on the head twice a week to stimulate the circulation and the hair follicles. As far as treatments in the office or in the hospital or the clinic are concerned, we do PRP and stem cells and antioxidants, and sometimes, although not because of the pandemic but because of permanent hair loss, we also do hair transplants. So depending on what the needs are and how the pandemic has affected the people, or how the underlying condition has showed up more because of the pandemic, we can take care of the hair loss as well. Some of the supplements like cinnamon can also be very helpful. Cinnamon is very helpful with your blood sugar as well as with stress and inflammation. So what we are trying to do is improve the oxidation of the lungs, but removing the bad products of oxidation of the tissues by using antioxidants, and also harmful effects of the metabolism which has already taken place, and of inflammation. So all those can be taken care of with exercise, diet, and some supplements. Besides that, I will go into specific treatments for each problem that one can have because of the stress and also because of the disease, as far as the cosmetic problems go.